We'll start with Mrs. Call. Your clinic provides post-abortion care. Could you tell us a little bit about the care for these women and include the types of medical complications and emotional hurdles that abortion in these women can experience?
Yes, thank you, Senator Grassley. So when a woman initially comes to our clinic, one thing that we prepare them for is just what the abortion procedure will entail. We give them factual information on that, and we let them know what the signs and symptoms of complications may be so that they know if they need to seek care after an abortion. We have had women come to us that are continuing to have pregnancy symptoms after an abortion, and so we will provide them with an ultrasound to check for any retained products following that abortion. And if there are, they're at risk for infection, and so we will treat them with Cytotec to help them through that. We also provide women with emotional support. By far, the complications that we hear most often from our clients are difficulty sleeping, depression, and difficulty in their relationships. We once had a woman call us after an abortion. She was struggling with feeling suicidal. Her family knew that she had had an abortion, and they were supporting her, but she just didn't feel like they fully understood. And so our nurse was able to connect her with resources to help her as she worked through the emotions that she was experiencing following that abortion. We also have women who come to us after an abortion or a miscarriage, and they say they just felt completely unprepared for the products of conception that would pass in their home while they are alone. When they see limbs and faces and eyes in their bathrooms at home, they are shocked and grieved at the loss of the child that they were carrying.
Okay. Mrs. Ford, you made a point in your testimony about our safety net system being disjointed and difficult for women and new mothers to navigate. Are these programs and agencies that are more complicated than others? And what can agencies currently do to make these programs easier for women to navigate?
Thank you, Ranking Member Grassley. Yes, I would say that women normally experience our safety net as deeply fragmented. So if they're looking for food assistance, they go to one agency. If they're looking for health insurance, they have to go to another agency and usually fill out a different application. If they're looking for help turning away from a situation with domestic violence, that's again a different application, a different caseworker. If they're looking for assistance getting back into the workforce and looking to WIOA, the Workforce Innovation Opportunity Act funding, it is again not just a different application, but a different location. I would actually point to the state of Utah as being the most fully integrated state. Their Department of Workforce Services has integrated more than 50 federal programs into a single agency. And caseworkers are empowered in the state of Utah to be able to connect the person in front of them to any one of 50 programs that fits their needs and that they are eligible for. Most states are not able to do that. Even in the state I serve on, the state of Virginia, the Department of Labor is disconnected from the Department of Social Services, and you must fill out 2 applications and be treated by 2 different IT systems in order to access the services to treat the circumstances that normally one family would face. So looking at integration should be a top priority to be able to assist families that are in need.
Yeah. Ms. Call, I've got a minute and a plus for you maybe to take any time that you didn't have time in your 5 minutes to tell us anything else that the committee ought to know about your work with helping women who are pregnant or want to be pregnant.
Yes, thank you. So I know we're talking about economics today, and women do often tell us when they come to our clinic that they're considering an abortion because of the financial concerns of adding a child to their family. One of these women was actually a teenage mom who came to our clinic with a 3-year-old son already. And her and her son were living in her car. And she did not want to bring another baby into that situation. And so she felt, again, that abortion was her only option. But after meeting with our staff and being listened to and heard and understood, the staff was able to give her information about adoption, which she considered but decided not to choose. But then also was able to help her find housing in our community, help her to get onto WIC, to apply for Medicaid, to receive food assistance. And when she had those resources, she felt empowered to carry her child. And we have the pleasure of continuing to have a relationship with this woman. And the father of the baby initially was in and out, but he has chosen to be involved and to assist her. And just last week, we were able to help him find a job that has full benefits and will enable him to provide for his family. And so we are able to be that safety net for these women and children and men. We never have a woman come to us and say, I wish I would have aborted my child. Every woman who comes to our clinic who is financially strapped or in difficult situations, they want to keep their children, and they just need the resources to be able to do that, and a network of people around them who will support them and walk through that with them without any judgment or shame. Thank you.
Thank you,